Hello, this is Dr. Gay from First Look MRI, and this is a 15-year-old female who was dropped at cheerleading practice, and now she has pain and instability of her elbow, and we can see that there are some abnormalities. On this view, it's a fat-suppressed sequence, so subcutaneous fat in the elbow around the periphery here is dark, and marrow within the bone is dark. The only thing that stands out as bright is fluid, which is abnormal. This is fluid in the joint, and marrow edema, which is abnormal. So here's some marrow edema in the distal humerus. The humerus comes down, and it has a medial protuberance here. We call this the medial epicondyle. And it has another one over here. We call this the lateral epicondyle. And to go over some more anatomy, this bone here, this main bone, this is the ulna. The triceps comes down and attaches to the back of this, to the olecranon process. This is the ulna, and there's another bone off to the side here. This is the radius. It looks like a little golf tee. And this is called the capitellum of the humerus. This is the radius. This is called the radiocapitellar joint, and we see there's fluid in that joint, which is not normal. We see this brightness in the bone, the radius here, and the humerus here. So we know that there's a bone contusion or stress injury. We see a dark band here. This is a ligament. This is the radiocollateral ligament. And also another ligament wraps around here and blends with this called the lateral ulnar collateral ligament. They're kind of together here, and we can see that there's no ruptured ligament out here laterally, but we do see there's marrow edema, so maybe that got stretched and injured, and it also could have impacted. This bone could have impacted in here. We could have had an injury where this widened on this medial side, and these two bones got close together and hit, and then maybe came back apart. But we see that there's bony abnormalities, but there's no rupture of the lateral ligaments. And now if we look on the opposite side, we'd expect when we see these kissing contusions or injuries here together along the side, we expect to see ligament injury out here, because if this widens, the ligaments may have been injured, allowing for this widening of the medial side, and then the narrowing and impaction on the lateral side. And that's exactly what we see. We see the ligament coming down here. There's a ligament called the medial ulnar collateral ligament. It comes off this bone here, the humerus. It comes down to the ulna here. And there are a couple components, probably not too important here, but just to go over them, we have a more anterior component called the anterior band that comes down here. And when it should attach over here, and we just don't see it, it looks like there's a gap right there. So this is part of the anterior band, completely torn, ruptured. If we go towards the back, we have the posterior band. These are broad bands that kind of blend together. The posterior band comes off the bottom here. This is broad attachment. And it comes down here. Here's part of it attaching to this bone. This is called the sublime tubercle, this pointy part. Some of that is here, but it looks like it's yanked completely off. There's a white band that's fluid, so it's ripped off, pulled down, completely torn posterior band, and a completely torn anterior band of that medial ulnar collateral ligament. So a very bad injury that's going to have surgery to fix. Also, there's a muscle here. This is part of a muscle complex called the common flexor muscle group. And we see this brightness here. This is edema in the muscle. And when you have an injury this bad, where we know this stretched really wide open and impacted over here, a lot of times the muscles will be torn. And indeed, in this case, the overlying muscle and tendon are torn right here. There's a little piece of the tendon where it attaches near bone. There's a little bit of fluid here, fluid-filled gap. And then here's that ulnar collateral ligament that's yanked right off and pulled down and lax. Now we're going to put up a side view here to see this a little bit better. This is a short axis view where we see the medial side, lateral side. Hard to see on this axial view. But if we put up a sagittal view like this, we can see in profile, we see the humerus coming down, capitellum, radius, radial head. We see there's an injury out here anteriorly involving the muscle. Now we're going to go over to the abnormal side, the side that's most abnormal. And here we go. And on this view we can see that there's a little marker here placed. In front we have part of that common flexor tendon. This is where it attaches to the bone, and this linear band is part of the tendon that's normal, but the back half of it here is bright, so this is where it's torn. So maybe the front half is intact and the posterior half is torn, and this edema here in the muscle is right here. The muscle is lax. So significant injury again. So we have a ruptured ulnar collateral ligament and torn common flexor tendon related to this widening of this joint. It must have stretched really far open and then came back together. And also we have these bone contusions or stress injuries on this side where the ligaments attach, but it does not look like there's any ligament rupture, and I don't see any bone that's been avulsed off. And thank you very much.